Chad Hasty Show, News Talk, KFYO. Joining us on the phones right now, Congressman Jodey Arrington. Congressman, good morning. How are you today, sir?
I'm doing well, Chad. Good to be with you, and thanks for having me on the show.
Yeah, absolutely. I guess we'll start off with the Payment Protection Program. Democrats right now, it's a very confusing time, it appears, in Washington, D.C. Congressman, you have, I believe, Steny Hoyer, who earlier in the week said that the House isn't going to meet unless there's an emergency piece of legislation or an emergency going on, which a lot of people started looking around and going, well, kind of seems like there's an emergency going around. The protection program has run out of money. Small businesses are begging for this money. And it seems like the Democrats are just standing in the way and saying, nope, not unless we get something else added to this pot.
Yeah, so if Mr. Hoyer and Pelosi, Madam Pelosi, would go to the unemployment line where there are now 22 million Americans, I think those folks would say there is an emergency. If you talk to the small businesses who are gasping for the oxygen they need, which is this immediate infusion of capital, and if you talk to working people and families who need their jobs, then I think all would say you can't move quickly enough to recapitalize the Paycheck Protection Program. That is the centerpiece of our recovery efforts because it will connect people to employment, and we would rather do that than have folks, a lot of people, millions upon millions, on the unemployment rolls. And it's a temporary, targeted bridge loan that will incentivize these businesses. It will give them the lifeblood and incentivize them to retain their employees. And we've depleted the resources. All the other funds for cities and states, for hospital and providers, those have not even been spent up to 50%. This one's been depleted, and she still wants to play politics with it. Meanwhile, folks are flat on their back and desperate for a lifeline, and we need to move quickly. It's all about Pelosi and their agenda right now.
Congressman, what have you heard from the business folks in this area, and how long can they hold on as far as a shutdown goes? I mean, how long can this last before they say, you can give us all the money you want to, or we're just not going to be able to do this?
Yeah, the Texas two-step to recovery is making sure that we get that lifeline in terms of liquidity to these local small businesses. More are in the queue, but literally hundreds of millions have been let out in West Texas alone, and countless texts and emails and calls I've received saying we wouldn't have survived without it. But the next step is to start phasing in the recovery and come out of this aggressive, zero risk, it feels like, posture to one of balancing our safety with economic recovery, which could be more disastrous if we don't start turning the lights on and get the wheels turning on our economy. You can do it smart. You can be measured. You can be responsible. All things should be considered at state and local levels, and all things should be taken into consideration in terms of folks' underlying conditions and their surroundings. Those should dictate at every level how we should begin to walk this thing forward into our recovery efforts.
Obviously, it's a decision you will not be making when Texas and West Texas reopens, but have you heard any type of timeline as far as reopening this area?
No, every community, and I have, 29 counties and lots of towns, some of whom have not been impacted at all, some more than others. Again, I think that every circumstance is different, but I think we can't wait much longer to start phasing it in. It doesn't mean that we have to do it all at once. Some situations will require extra precaution. We still need to be extra careful with our vulnerable and folks with underlying health conditions. But I do think we're in this zone where cases are flattening out, deaths are dropping, Folks are recovering from COVID, and still we have the majority of people who get this, the vast majority, who have little to no symptoms. But what's key in this, Chad, is we've got to have the testing capacity. We have to have the testing capability, and that's getting better and better every day, every week. But that's going to be key to the confidence of getting back and managing this so that we don't see a resurgence in the fall that's worse than what we've just gone through.
Do you worry, and you know this, and I relate this back to September 11th because you were there. You were in the Bush White House, during 9/11, and the laws and some of the different plans that came out. There were always questions about the constitutionality of some of the plans that came out. Same thing's going on now, with cities, closing different things, requiring face masks or else you're fined $1,000. There are people who are asking the questions, where do local leaders and statewide, where do they get the ability within the Constitution to do this? What would be your answer to that?
My answer is first and foremost that federalism is a strength of ours in terms of localizing the decision. So I do not believe in a one-size-fits-all with respect to most decisions, even though there are broad powers with respect to national security vested in the federal government. But I also think there is a balance between the security of our citizens and their freedoms. I also remember 9/11 very vividly as a member of the Bush White House team. And I think what happens is you overreact initially because that's the natural reaction. You want to stave off any further damage and harm. And then you start to relax it and come to a better balance between the two. And I think that's what you're going to see in the coming days and weeks. And I think, by the way, it's appropriate for the citizens of Lubbock and all other communities throughout the country to make their voices heard. But there are many factors involved. It shouldn't just be Fauci and epidemiologists and health experts on safety, and it can't just be all about business. It has to have some combination, and it has to be done, again, according to the circumstances, situation, science, data, and every community's different. But we've got to move quickly to phase in that direction.
Congressman, we got to take one break. Let's go ahead and do that. When we come back, we'll continue our conversation with Congressman Jodey Arrington here on the Chad Hasty Show. All right, Chad Hasty Show, News Talk, KFYO. Congressman Jodey Arrington with us. Congressman, I want to ask you about China and the World Health Organization. President Trump has said we're going to pull money from the World Health Organization. Nancy Pelosi doesn't seem too happy about that. What do you think needs to happen as far as the World Health Organization goes? And also China. They had a huge role in this, obviously, and it seems like they were covering up information. What should happen?
Well, Pelosi and politicians on both sides of the aisle would continue business as usual. They would not have responded like President Trump, and we would have been in the same position we were with NATO and other international organizations where we're carrying the water for everybody and nobody's taking responsibility. In this case, like in other appendages of these international organizations, there's corruption, there's complacency, there's ineptitude. And we see that with WHO, our World Health Organization, and its supposed leader, the Director General, who should be fired immediately for helping with this cover-up. It's one thing for the Chinese in the communist China to have control and cover-up posture on getting data out that would have been important to stave off this worldwide pandemic. But it's a whole other thing for the WHO to be complicit in that. And we need an investigation. And ultimately, China needs to pay restitution to not just the United States, to the world. And why in the world are we paying $400 million to that organization and they pay $40? At a minimum, it should be based on population. And on top of that, it should be based on risk. You should have risk-based membership dues. And if that was the case, China would probably pay for 2/3, if not more. And that's how we should do this going forward. The president did the right thing, and we should not resume our engagement and membership and funding that organization. until they do the right thing, no more business as usual. That's where I think President Trump is, once again, the right guy for these times.
Congressman, we'll go ahead and wrap up today's interview because we're running out of time. We appreciate you joining us today. Let's visit again soon because this crisis, it's going to continue for a while, and I think there's going to be more fallout from it, and it's going to be a pretty important thing to discuss moving forward.
I look forward to it. Let's get America back to work. God bless, and go West Texas.
Thank you. That's Congressman Jodey Arrington here on the Chad Hasty Show, News Talk KFYO. And listen, this is it's an important issue. You know, what to do with China, what to do with the World Health Organization. Nancy Pelosi yesterday, I think it was yesterday, saying, "Oh, the president, he shouldn't be doing anything like this." Like, where's her allegiance?